In modern medicine, our goal is to provide the best possible care, guided by a principle known as evidence-based practice, or EBP. This approach means that every decision we make is a thoughtful combination of three key elements: the best and most current scientific research, the seasoned expertise of your clinical care team, and most importantly, your individual needs, values, and preferences as a patient. It's about ensuring that the treatment you receive isn't just based on tradition, but on proven, effective methods that lead to better health outcomes. For individuals undergoing dialysis, this principle is not just important, it's absolutely critical. And it starts the moment you walk through the clinic doors. Every dialysis session begins and ends with a weight check. It's a ritual so familiar it can feel automatic. But what if we told you that this routine step, while essential, isn't enough to determine your true, optimal dry weight? What if this fundamental measurement, the very foundation of your treatment, could be giving us an incomplete and sometimes misleading picture of your health? Let's take a closer look at this process. When you step on the scale, it gives us a single number: your total body weight. Your care team then subtracts your last post-dialysis weight to calculate how much fluid you've gained. This information is used to program the dialysis machine to remove that excess fluid, aiming to get you back to what we call your estimated dry weight, or EDW. Estimated dry weight is the target weight patients should ideally reach after a dialysis session. It represents your body weight without any excess fluid. Achieving the correct EDW is critical for avoiding a host of complications, from debilitating cramps and low blood pressure to long-term fluid overload and cardiovascular stress. The problem is, relying solely on the scale to determine this crucial target can be like navigating with an unreliable map. The scale tells us you weigh, but it tells us nothing about that weight is composed of. Is that extra 2 kilograms pure fluid? Or is it a combination of fluid, a good meal, or even a welcome increase in muscle mass? The scale doesn't know. When EDW is miscalculated based on this limited information, patients may suffer. If the team overestimates your fluid gain and removes too much, you risk intradialytic hypotension, a sudden drop in blood pressure during treatment. This can lead to intense muscle cramps, severe nausea, dizziness, and an overwhelming feeling of being washed out for hours or even days after your session. Conversely, if we underestimate the fluid and remove too little, that excess fluid remains in your body. This retention, known as hypervolemia, puts a constant strain on your heart and lungs, leading to high blood pressure, shortness of breath, and swelling. Over time, chronic fluid overload is a major contributor to the high rates of cardiovascular disease seen in dialysis patients. This is where evidence-based practice demands we ask, is there a better tool? The answer is a resounding yes, and the evidence is mounting. A pivotal study by Gomes et al., 2023, published in the Renal Society of Australasia Journal, explored this very issue. They investigated the use of a technology called bioelectrical impedance analysis, or BIA, in outpatient hemodialysis settings. Their findings were clear and compelling. BIA is not only feasible to use in a busy clinic, but it is far more accurate in assessing a patient's body composition and fluid status. The study showed that when clinicians used BIA to guide their EDW decisions, patients experienced fewer negative symptoms and their fluid levels were managed more effectively. And this isn't an isolated finding. It's part of a growing wave of international research and clinical practice guidelines that all point to the same conclusion. BIA is a vital tool for modern dialysis care. So, how does it work? Bioelectrical impedance analysis is a quick, non-invasive, and completely painless test. It works by sending a very low-level, safe electrical signal through the body, typically via small electrodes placed on your hand and foot. Different tissues in your body resist this signal in different ways. Body water is an excellent conductor and has low resistance or impedance. Body fat, on the other hand, contains very little water and has a high resistance. The BIA device measures this impedance, and through sophisticated algorithms, it translates that measurement into a detailed breakdown of your body composition. It gives clinicians a clear, objective picture of your hydration status, distinguishing between the fluid inside your cells, which is essential for health, and the excess fluid outside your cells, which is what we need to remove during dialysis. Let's put this into perspective. The scale gives us one piece of information: total weight. BIA gives us a full dashboard. It separates your weight into its most important components: extracellular water, intracellular water, lean body mass, and fat mass. This is the difference between a single ambiguous number and actionable clinical intelligence. For example, if a patient gains weight, the scale can't tell us why. But BIA can show us that the gain is 90% extracellular fluid, allowing the clinical team to set a confident and precise ultrafiltration goal. It can also track changes over time. If BIA detects a gradual loss of lean body mass, it can be an early warning sign of malnutrition, prompting a referral to a dietitian long before the problem becomes severe. That's the kind of deep insight we need to truly personalize dialysis treatment and practice proactive preventive care. This technology also empowers you, the patient. Evidence-based practice is a partnership. Your role is absolutely vital. First, continue to be diligent with your weights. Learning to record accurate pre- and post-dialysis weights, using the same scale and wearing similar clothing, provides a consistent baseline for your care team. Don't guess, don't round, be precise. But your role goes beyond that. Be an active participant in your care. Talk to your team about your symptoms. Do you feel washed out after treatment? Are you experiencing cramps? Are you short of breath at home? This subjective information is a crucial piece of the puzzle, and don't be afraid to ask questions. Ask if your clinic uses or has considered using BIA technology. You are your own best advocate. It's time to move beyond relying solely on the scale. The evidence is clear, the technology is available, and the benefits are undeniable. Bioelectrical impedance analysis should be introduced as a matter of urgency and adopted as a standard of care in dialysis centers everywhere. It is the embodiment of evidence-based practice, combining research, technology, and clinical expertise to improve patient well-being. Shifting from guesswork to precision means safer treatments, fewer debilitating symptoms, and a better quality of life on and off the dialysis chair. Better data means better conversations, better decisions, and ultimately, better outcomes. Let's champion this change together. Let's make evidence-based practice the unwavering standard in dialysis care, because your health, your comfort, and your future deserve nothing less.